Hey YouTube, this is actually gonna be a channel about my weight loss surgery, process, journey, diary, whatever you want to call it. Um, the reason why I'm considering doing a weight loss surgery is because I've been basically obese my whole life since I can remember. I don't remember being not overweight, not obese. I tried dieting, exercising. I would lose weight. Then gain it right back. Then lose it and gain it back. The back and forth thing. I'm actually tired of going through this back and forth thing. It's emotionally draining and it makes me really upset. You know, I try. Well, I guess it's the sickness that I just can't control myself with the way I eat or the way that I just don't like exercising like I'm supposed to. There's actually not the easy way out. If you see videos about weight loss surgery, they always say, people always say, oh, it's the easy way out, you're giving up. It's not the easy way out. It's a very hard way out, actually. I'm gotta do all this paperwork and going back to the doctor in and out. You gotta take vitamins for the rest of your life. It's not like it's like you do the surgery and you just lose the weight. It's not like that at all. You have to eat right. Eat the right things because you couldn't gain the weight right back. You have to deal with the excess skin and all that stuff there. So I'm actually 18 years old, and I just think it's like the right time for me to do the surgery. Not wait too long because I just seen a lot of like pictures of when old people do it. I'm not gonna make no old people feel bad about doing the surgery at that age because I'm so glad it's a good thing that you've done it. But it's better when you're young because your skin is still tight and it's not loose. So when you lose the weight, it won't be as loose as an older person. I hope you can hear me because I'm using my webcam and it's actually, webcams are not best quality. But my phone is actually charging and it's dead. And I did try to make a video twice on my phone and people just keep interrupting me. So I just think I should just do it on my webcam back. So I went to a seminar at Lennox Hospital, which I was planning to do my surgery at, and I really like the hospital so far. The surgeon I actually picked was actually the one talking at the seminar, and that's why I decided to pick him because I just like how he explained it, and he's actually the director. Actually, they gave out the sample, and I read about him. Of course, this is actually my surgeon, Dr. Roslin, Mitchell Roslin, and yep, he is he's actually the chief of the bariatric center thing at Lennox Hospital. He's the chief, the director, whatever you want to call it. But I really like him and he's a really nice guy. I did go to my consultation appointment already, and he just asked me what surgery I wanted to do. What did you learn from the seminar? And before I went to the seminar, I actually was planning on going with the gastric bypass. But then I changed my mind and I'm going with the duodenal switch, which is actually the most complicated surgery and it takes longer actually. They do most of the time do it open, but they do laparoscopic. They actually do a laparoscopic too. I did forget to ask him if it's a chance of me doing open, because if I have to open, I'm gonna have to switch it. I don't want to open surgery. I just don't want a big scar on my stomach. But it's a long-term thing, guys, with the duodenal switch. I know a lot of people probably don't really know a lot about it because it doesn't have a lot of pictures on YouTube that actually done a duodenal switch. The most I saw it was like 5 people, and that's a lot of gastric bypass. on YouTube. A lot of people that done that. I saw a couple of gastric sleeves and I saw a lot of lap band. But not a lot of duodenal switch patients. My surgeon actually is really educated on duodenal switch. He's done a lot of surgeries. And of course I asked him if he had any patients dying. I think he told me one time one patient did die. I think it was 2002. So it was a while ago, and I know that they learn more stuff about the surgery and they're more educated about it. So just go back to the consultation when I went to the doctor that day. So I talked to him, learned a couple of stuff, and he said the duodenal switch would be perfect for me just because I have a BMI of over 50, guys, so that's really bad. And he said I will reach, if I do the right thing, take my vitamins, eat the right food, I will reach my ideal weight. My ideal weight is actually 140 to 150. That's my ideal weight, but I will be fine if I just in the 190s. I don't care. Just want to be out of the 300s, out of the 200s. I'm done seeing the 2 and the 3. I don't even know when the last time I saw myself on the 100. I think I'm on a video. So I did see the psychologist that day. She was very nice also. So I got that off the way on my checklist. So my checklist, it's before insurance approval. Attend an educational seminar. I did that. Complete a ME. I did that. Make an appointment with the surgeon, nutritional consultation, and psychologist evaluation. I did the surgeon and the psychologist. I couldn't do the nutrition. I actually did have a appointment for 3, but that day she wasn't there, so I have to go back in 2 weeks for that. I have to have a TSH blood test done. I already did that actually before I went to the appointment, so I already had that on my file. I have to do a preoperative UGI. I actually went today for a consultation for the UGI because in my doctor's clinic, you actually have to do a consultation with the GI doctor, and then they'll do the schedule for the UGI. And sadly, I have to be on a 6-month diet for my insurance, and I'm on month 2 already, so I'm doing pretty good so far on my list. Just have to do the UGI, and I have to finish my 6-month diet and see my nutritionist. So my next video, my daughter's crying actually now, so I had to cut the video. My next video will be after I do the UGI and the nutritional evaluation. Bye guys.